Hi, I'm Sarah Jane. I'm a specialist podiatrist here at the Rehab Hub's Verruca Clinic, so Verruca Clinic, Glasgow. We have clinics in both the west end of Glasgow and the south side of Glasgow. If you have been battling with a verruca that just will not shift, even after using every over-the-counter product out there that there possibly is, maybe seeing your GP and you're still getting nowhere, then listen in. The verrucas are caused by the human papillomavirus, and while they're really common, they can become really painful and stubborn, especially if they've been hanging around for months or even years. We've had some patients in that have had their verrucas for over 40 years, that you can end up with warts on your hands that are part of the same virus, and we do treat them as well. So that's always a question people ask, can you treat these warts on my hands? And we absolutely can. Now here at Verruca Clinic Glasgow, which is within the Rehab Hub, we use a cutting edge treatment called Swift. This treatment uses microwave technology to trigger the immune system to fight the virus from the inside out. There's no messy creams, no freezing, no downtime, nothing for you to do between treatments, basically just fast and targeted treatment. Now, this treatment is perfect for children, athletes, and essentially anyone who's tried everything with no success. We'll always guide you through the process with care and honesty, and that all starts with a free consultation. We want you to feel informed and to be able to make the best choice for you or your child. Now let's talk about cost, because it's really important. We're always open and transparent about everything. Now, Swift, it is not a cheap treatment. However, sometimes cheap treatments can be a bit of a false economy. And this is one of the main reasons that we converted to Swift and moved away from some of the other treatments that we used to do on patients with verruca. And I'll explain a little bit about that here so you understand why. Now, each Swift treatment costs £130, and most people need 3 treatments spaced 4 weeks apart. So that would mean that you would be coming monthly for 3 months, and you would be £130. Now that's most people, but most people isn't everyone, because some people do need more and some people do need less. We've had children come through our doors that have only needed 1 treatment, but that is very unusual. Most people do need 3. However, if you've had your verrucas or warts for a long period of time, and generally we're talking, some people have had them 12 years, 20 years, 40 years, and beyond. We tend to see that if you've had your verruca for over 12 months and it's been really stubborn and not shifting, those clients usually need 4 treatments. Now, we would assess this when you come in. We'd always be really open, honest, and discuss with you what you're likely to need. But usually when you've had them a little bit longer, you need more treatments. Now, most treatments that somebody has needed has been 12. So 12 treatments, and that was over the space of a year and a half. This particular patient had multiple verrucas for over 40 years. So they had warts in their hands, and we didn't actually count how many they had in their feet. There was over 50, there was a lot. And this particular patient had tried, you can imagine, they had tried everything and nothing had resolved. And this particular patient needed 12 sessions. So that is the most extreme that we've ever done. But we resolved them, we got it all going, the help with the immune system and treatment, and that patient was absolutely delighted. Finally, after 40 years of battling these things, they were gone. So that is the most that we've had. Now, another thing that patients ask us is, will it 100% work? Can you give me a guarantee that this will work? And the honest answer is that does not exist. There is no treatment that is 100%. But what I can wholeheartedly tell you is that Swift is one of the best, if not the best treatment out there on the market for verrucas and warts. Now, a very close treatment, we're always honest, open, transparent, evidence-based. We'll always give you the most, I suppose, what I'm trying to say is give you the information that you can use to make a decision. There's another really good treatment that has very good results similar to Swift that's called Verruca needling. Now, Verruca needling involves you getting what's called a tibial block. And it's something we have done for years and we got great results from it. Now, it involves getting an injection into your ankle. So we block off the tibial nerve. So that's just at the inside of your ankle, the big lumpy bit at your ankle, so the medial malleolus. We give you an injection of local anaesthetic to numb and take out that tibial nerve that innervates the plantar aspect of your foot, so the sole of the foot. We then, once that's all numb, we would then basically damage your foot via a sterile needle, where we essentially lots of times with a needle and we push the virus into your bloodstream. And what that does is it causes damage, and essentially your immune system comes and says, oh, wait a minute, there's damage here. It then stimulates that immune response, and the immune system then comes and deals with the verruca. Now, that's a very successful treatment as well. Now, we can offer you that here as well, but it's actually quite an expensive treatment as well. You're hundreds of pounds for that treatment. Usually you'll need 2 sessions of that. Sometimes some people need 1, but usually 2. So that could in the end cost you about £750, £800 for that treatment. Now, we've not done any verruca needling in, goodness, probably about 1.5 years since the last time I have done one. And the reason being is because Swift has been so successful for our patients. And also with Swift, there's no needles, there's no blood, there's no risk of infection because we're not creating any portals of entry, there's no breakage of skin. So Swift for us has just been something that has been less of a barrier. Also, a lot of patients really don't like needles. So getting an injection into your ankle can be a big put off, especially for children. But I think, to be honest, adults as well, none of us like it. So that can be a big barrier. But in terms of when we look at the results that you get from Swift and the results that you get from verruca needling, they are very similar. There's not one better than the other. So to me as a clinician, if I don't need to create a wound and I don't need to inject you with a drug, that is a big win. So that's why we moved a couple of years ago to fully really getting behind Swift for our clients. Now, we've had such great success rate. Now, in terms of what I would say our success rate is here in Glasgow, it must be well over 90%. There are some people where these things just will not leave them. And it's usually patients where they're maybe immunosuppressed or they've got some other underlying health conditions going on that they're just not resolving. So they can be stubborn things, but the results that we get, I can honestly, it is your best option, best thing out there in the market if it's something. I would always say to people when they're coming in, make sure you've tried other things first. So I wouldn't say that Swift should be the first thing that you come to, because it is an expensive treatment. And sometimes verrucas will just resolve themselves. So give it a little bit of time, maybe just get some verruca, give that a try. And if it's not resolving and you feel that it's spreading, then that's when you seek help from a treatment like this. You could also try excluding basically covering the verruca up. Some people call that the duct tape technique, and that can be pretty successful as well. So I would give them a try. That's what I would do with my verruca. If I had a verruca, I would probably just cover it up with some tape. I would maybe try some occlusion therapy first, and if it wasn't resolving it, then I would go for Swift. So I wouldn't just jump straight into any of these more podiatry-led treatments right away, because a lot of the time you don't need them. For most people, they don't need these things, but it's when they've been a bit more stubborn, or you're noticed they're spreading, they're getting bigger, they've maybe jumped over the other foot, or they're maybe going to your fingers and things as well. You might be like, nah, I need to get this resolved. That's really when you want to be engaging with a podiatrist. So if that is you, come and book in for a free consultation. Just come in. There's no obligation. We will give you honest advice. There's no obligation to be booking any treatments if it's not right for you. We'll always tell you the truth and allow you to make an informed choice. You can call us on 0141 363 0306, or you can book online. The link is below this video, and you can book 24/7. We have the clinic in the West End and also in Canning Park. Thanks for listening.